In today's Women's Care Wednesday, two Women's Care Florida providers, Amy Renke, a certified nurse midwife, and Dr. Jennifer Gilby, an OB-GYN physician, are here to explain what sets apart a certified nurse midwife, aka Amy, from a physician. Welcome. How's everybody?
Great. Yeah.
So this is a good one because I at first was kind of confused about this and who steps in where, who does what. So let's first talk like education and actually the certified part of your title.
Yeah, we can kind of both talk about that. So as a certified nurse midwife, we all started as registered nurses. So most of us, at least in our practice, have some type of OB experience in floor nursing. And then, so that's typically like a 4-year bachelor's degree. And then we went on to get a 2 to 3 year master's degree that specializes in women's health care. So
and in that you get clinical experience.
Yes, absolutely. There's a certain amount of hours that we have to reach and a certain amount of babies that we have to deliver, and
Well, I would say let's talk. What do you do in the delivery room versus Dr. Gilby? I mean, how does the whole relationship? Let's paint the picture of what people can expect.
It's a great question. So, I mean, how I just quickly like to describe it to patients is we specialize in normal vaginal deliveries, whereas OBs are really, really good at surgery. And that's kind of how we work together.
Midwives are one of the most fabulous components of our practice. I mean, and having them, they are there at bedside, they are with the patient, they are helping them through labor, they are, helping them reach their goals. A lot of women come to us with a birth plan, things that they would really like to achieve out of their labor and delivery process. And, I think the midwives are their support and they are there to help them. If they want natural labor, they help them to achieve that. If they don't want natural labor, that's okay too. Midwives handle really everything with the exception of the operative deliveries. So, if the baby's just not coming with pushing and we have to do a vacuum, or if even that isn't working and we have to do a C-section. So, I think the component of us being able to collaborate and be there as a team for those patients is just really an amazing experience for everyone involved.
The best of both worlds.
It really is because, I think that they're able to be there constantly, answer questions, help ease their, concerns or fears. There's just so much that goes on in the delivery room and uncertainties of what's happening. It's not just a nurse at bedside while the doctor's in the office and you're getting a phone call from the doctor to the nurse. I mean, you physically have a provider there, so it's amazing.
Well, and I think maybe, and this is completely a wrong stereotype as I know now, but I would feel like, okay, well, I don't want to have too many people in my room and I don't want to upset my OB-GYN by asking for more help. Like, I don't want to be, in a kind of like disrespectful world. And you're saying, oh my gosh, it's quite the opposite.
Yeah,
you love
absolutely.
it, right?
And we each have our own role. And I think in our practice specifically, one of the best things is if the delivery does end up in a cesarean, we as midwives who have been laboring, have been at bedside, have been, really, really through the process with them. It is always a joint decision whether you, end up in a cesarean. And then also we go back and first assist with the OBs. So we're back there in the operating room with them. And yes, our patients all have met the doctors and love them, but they know us better. And so I think it is super helpful for us to go back with them.
I think the other thing too is that in our practice, you don't have to have one or the other. You can say, well, I really would prefer a physician to be my caretaker. I really would, or I really do want the midwives. Almost 95% of our patients meet the midwives and want the midwives. I mean, they rarely say, I don't want the midwives. I mean, but we're always, our patients have options. It is, you can have one or the other, both at all. There's always two of us on call at any time.
Well, I'll say I don't think we could have ended that segment any better than what Dr. Gilby was just saying. You have all the options, and that's where Women's Care Florida, of course, comes in. If you have any questions, want to see which option is right for you, which is the key, there's the website you see on your screen. Ladies, as always, thank you both.
Thank you.